Hello, my name is Sheela Sajan. My project is implementation of metabolic screening tool to improve metabolic monitoring and reduce metabolic syndrome in psychiatric patients taking second generation antipsychotic medications. My project chair is Dr. Aline Holmes and my team member is Dr. Dianelys Garcia. Metabolic syndrome is a progressive chronic condition that affects the individual's physical, mental, sexual, and social functions while increasing mortality and morbidity rates. Providers give less importance to metabolic screening and less preference for metabolic syndrome in psychiatric patients. Background and significance. Recently, the increased use of antipsychotic medications to control psychosis increased the risk of metabolic syndrome. Around 50% of individuals with serious mental disorders taking second generation antipsychotic medications were undiagnosed with the metabolic syndrome. In the United States, 49.2% of psychiatric patients are affected by metabolic syndrome, and the annual healthcare cost for treating chronic and mental health conditions is $3.8 trillion. Need assessment. WHO developed Mental Health Action Plan 2013-2020 to promote mental health, reduce disability, mortality, and morbidity rates in mentally ill people. CDC recommends that all healthcare professionals to take action to promote mental health, and the project site explored the gaps in the current practice as well as the effects of metabolic screening through an evidence-based screening tool. Clinicians were lax with regard to metabolic screening and demonstrated a lack of essential knowledge about screening and monitoring for metabolic syndrome. Purpose of this study is to improve clinicians' knowledge about metabolic syndrome, screen patients with an evidence-based screening tool, and refer patients to primary care for metabolic treatment. Aim of this project is to reduce metabolic syndrome in psychiatric patients. Objectives are educate clinicians about metabolic syndrome and the importance of metabolic monitoring, audit charts for metabolic parameters and demographic data, screen patients at baseline, and monitor every 4 weeks for 2 months with an evidence-based screening tool. Methodology. Retrospective chart audit, pre and post survey is the design of the study, and the setting is an outpatient behavioral health clinic. Population consists of both patient and clinicians. Clinicians, all staff working in the clinic, and patient population having a diagnosis of mental illness, taking second generation antipsychotic medications, 18 years and older. Sample size 40 patients and 25 clinicians were participated. Intervention chart audited for demographic and metabolic parameters. Educated clinicians. Then the clinicians completed pre and post survey. Results of this study shows a statistically significant improvement in clinicians' knowledge after 2 months, and incorporating the evidence-based metabolic screening tool in their clinical practice and collaborating with other physicians. Implications to clinical practice: educate clinicians and patients, regular metabolic monitoring with an evidence-based screening tool, interdepartmental collaboration, healthcare policy, update hospital policies, and limited number of published studies. Quality and safety, decrease morbidity and financial loss, education, standardized screening tool, metabolic syndrome prevention, ongoing staff education, good health outcomes. Please see the contact info for further questions. Thank you for listening.